Good morning, ladies and gentlemen. Welcome to this session on trust in science through the use of fair data. I am Lydia Borrell-Demian. I am the Secretary General of Science Europe, and I am honored to moderate this session. And I hope that you will be engaging in the discussion. I first would like to thank the organizers of this very interesting conference for the invitation to this conference, as well as the invitation to my great speakers today. We have Ingrid Dillo, coordinator, first of all, of the Fair is Fair project, funded by the Horizon 2020 project, but then now coordinator of the Fair Impact project from Horizon Europe. Right. Since June last year. Then we have Elina. No, sorry. Daria Fischer from Clarin Eric. She's executive director. And to my right, Elina Dagvik, thank you, from Health Data 2030 and Citra. So the three of, together with them, we are going to explore key concepts of trust in science and through the use of findable, accessible, interoperable and reuse data. I would like to make a link here with the UNESCO declaration, I'm sure you are all aware of, because that UNESCO declaration is, for me, in my view, a hallmark in the progress towards open science and the will of that body to contribute to make that wish a reality. Of course, I would also like to mention another very important piece of political commitment, this time from the European Union, with the Council conclusions that were adopted on the 23rd of May this year. For us, this is a breakthrough regarding the commitment of member states to provide non-for-profit models for open science, and of course, that goes along with it, access to data. We are conscious that there is a dynamic. If we concentrate our attention on fair data and trust in science, there is a dynamics established between the researcher and the data, and the need for certainty on how to use and reuse the data. So I would like to stop my words of introduction here. I think that the frame is clear. Yesterday we had an excellent presentation by Karel Leuven, where he explained in detail what fair data is and means. So I don't think we need to go into that. I think we are all experts in this field. And I would like to have to start with Ingrid, from your perspective, your wonderful knowledge on fair data, all of your experience, Ingrid. Where do you think you are the main challenges to progress towards fair data, and what can we do about it?
Thank you very much, Lydia, and thank you everybody for choosing this session. I'm really happy to be here today and to talk a little bit about FAIR and trust in science. First of all, about that trust, I think trust, and you related already to that element, Lydia, is all about the quality of the data that researchers reuse, and that trust in that quality. And I think quality has different aspects to it. It, of course, starts with the research upon which the data are based itself. So that is about the science that is at the basis of that is that of high quality. That is, of course, question number one. Second question is about the technical quality of the data. Is there enough information to assess the data? And I think that is the element where FAIR comes around the corner. And finally, of course, there is always the element of fitness for use, fitness for purpose, because sometimes a researcher is willing to accept the fact that the data has not yet been reviewed because he or she needs the data as soon as possible, the next day. So then it's up to each researcher to make that their own assessment in a way. But let's concentrate on FAIR, and there I would like to take you back to January 2014. because in that month I was by accident all of a sudden present in a workshop in Leiden that was organized around the life sciences, and I'm a maritime historian, so I had no business there in a way. But I was there, and that happens to be the place where the term fair was more or less invented. So that was a historic moment. And of course, we all know that these FAIR principles have been a great success. They are promoted everywhere, I think, around the globe by policymakers and funders. And now we are almost 10 years since that workshop in 2014. And where do we stand with the implementation? Because the ultimate goal, of course, was fair data by design. We heard it this morning. Fair data as completely machine actionable units. Well, to give you some examples of where we are, my organization DANS participated last year in a big survey that we did to assess the European research data landscape. And for that work, 15,000 European researchers were questioned, and also a lot of data repositories were examined. And to give you some numbers, only 40% of the researchers said that they occasionally store data in a repository. 40% has never heard of the FAIR principles. Now, you could argue that that maybe is not a problem, that you don't know the acronym, as long as you comply with the FAIR practices. But we asked about those FAIR practices also, and then it turned out that only 1 out of 5 researchers answered that they put those practices in their daily work. Only 17% of the researchers said that they published their data with a license, which is a necessity if you want to reuse. Only 19% said they acquired a persistent, unique and global identifier for their data, etc., etc. So still a very long way to go. And what do we need? We need researchers trained. We need to provide them with tools and support to enable them to comply with all of these new concepts. We need data stewards to help them along, and these data stewards themselves also need to be trained. And we also see researchers, of course, struggling, we all know that, to find time and to put the effort into making their data fair. And there we run into the problem of the fact that they don't get any academic recognition for all of that work. So we need to reform that system. And that is happening, fortunately, at the moment. We are on our way. But now I also hear researchers in my own countries being afraid that this will add to their workload, not take away the pressure from publishing, but just adding another layer of expectations. So what else do we need? I think we need to be very inclusive. So we shouldn't say data are fair or not fair. We should see it as a continuum, because we need to also acknowledge the differences in the different domains. I think in a lot of presentations we heard about the life sciences, and they have a long history of collaboration and of data sharing, but in other domains it's different, and we need to take that into account. We also see differences in geographies. So it's a journey towards FAIR that needs to be inclusive at different speeds and from different starting points, I think. And 100% fair for all the data that we produce is simply not possible. And then we also have legacy data. What do we do with them? A huge amount of them. And backwards engineering FAIR is very resource intense. And we have to deal with a lot of sensitive data in many areas, because they are an integral part, I think, of open science, but they need extra care, they need an extra layer of governance, access management at the right level of granularity, etc., etc. So we need to make choices where we put our effort into making data fair. Yesterday, Karel made a plea of starting with data that are published with publications and making it mandatory to make them completely fair. But you could also think from a perspective, for example, of the SDGs and the EU missions, really the big societal challenges. And maybe we need to start with the large-scale data sets that are needed in these areas. That ask for interdisciplinary interoperability to integrate the data sets from the different domains to deal with these big challenges. So maybe that is an element where we should start. So lots of questions still, and I also think that we need to think about the question, in which cases and for which data is a certain level of fair enough? So I think I put more questions than answers on the table, but I'll stop now.
Well, that's what we are here for. So thank you very much, Ingrid. Thank you very much. Indeed, that was very good to set the general scene. So now let's analyze some more specific examples. So Daria, please, from your perspective on social sciences and humanities, what can you say?
Hi, can you? Sure.
Yes.
Hi. Hi, everyone. My name is Daria Fischer. I'm the Executive Director of the Clarin ERIC Research Infrastructure, and we deal with language data. It means all modalities, text, speech, multimodal data. It also means all languages, not only European, but really all languages we try to focus on. And we also try to not only focus in terms of research interests on linguists or computational linguists, but really all disciplines that use language data for their research, whatever their research question, method, and discipline might be. And with this, I think we come into practical issues of a lot of questions that you have raised, because when you are even willing to collect and make your data fair, it's quite a tall order to be able, you yourself as an individual researcher, imagine all potential reuses of your data, and if data is reused by researchers from another discipline, that's, I think, a difficult task, and I think that data stewards should be there to help with those examples. For example, when computational linguists collect parallel corpora to train machine translation systems, the same data for free could be then relevant for translation studies people. But because computational linguists, they don't care about the status of the source and the target language, they don't record this in the metadata, and this means that the entire data set, however expensive and complex it was collected, is not useful for the entire research community. The same goes, for example, with ethnographic interview collections. There's researchers in anthropology and ethnography, social science, that does really brilliant ways of selecting their speakers, traveling there. It takes 90% of time and energy and money for them to collect the interviews. Then they use it for their own research. They just make snippets, summaries of whatever it is that they're interested in that interview, but do not record the entire or transcribe the entire interview. And this is a pity, because then the carriers of the interview recordings become obsolete, and there's no, for example, dialectologist or another ethnography researchers who could reuse the same recordings for another purpose. And this is something that we still need to encourage in terms of talking across disciplines, and it's quite hard to do. What I would like to show you is an example of our efforts to make sure that data is as interoperable and as fair as possible on a data type that is relevant in a broad set of disciplines. And this is the work that was started in the context of the Clarin resource families a couple of years ago already, but we intensified it into a flagship project called Parliament during COVID, where everyone was interested in what's going on in national parliaments with respect to discussions and decisions on the vaccines, on mask wearing, on lockdowns, etc. And it's actually very interesting, but also harder than you'd imagine at first, because while these data is easily accessible, every parliament publishes it online, it's structured differently. They have different rules in terms of how parliaments operate. They're also all in different languages, in some parliaments more than one language. And what we did was we got a community of researchers together. We produced a comparable and interoperable corpus of 17 languages at that time. Now we're going to release a new version of 30 parliamentary corpora that are all encoded in the same way and then enriched with linguistic annotations at the same level using the same schemas, also machine translated into English. So that they're fully interoperable. But for just these 17 languages, a huge team of international researchers had to make sure that this happens. What we did was we developed a methodology that uses these subcorpora and collects them in a uniformly encoded way. We also added manually quite a lot of metadata about the speakers, which party they belong to, their socio-demographic data, etc. And then we also made all these corpora directly accessible through tools to analyze them online, as well as download them. And now they're being used by researchers also in very other disciplines within the EOSC science projects, combining this data with voting data, with Twitter data, but also with biomedical data. So we can easily say that we've turned the heterogeneous data from national parliaments into a sort of parliament infrastructure, where it's not just the data set that we are delivering, but also a joint representation model of this rich landscape of parliaments in national contexts. They all go along with common data, metadata, common document structure, and common linguistic annotation. And at the bottom of the slide, I provided links for you to take a look at if you want to download or view this result.
Excellent. Thank you very much, Daria. Great example. So now let's move on to a health issue example.
Thank you, Lydia, for the introductions. So my name is Elina Troakvik, and I'm from the Finnish Innovation Fund, Sitra. Thank you very much for inviting me here in this panel, and I also want to take the opportunity to congratulate the Swedish presidency for the excellent work you have been doing in this field and also keeping these issues high on the agenda. I was actually supposed to be in a conference in Canada at the same time of this meeting, but I of course chose this event because I think it is of major importance. I think with the help of data, with the help of research and innovation, science and the research infrastructures, we can really contribute to solving the societal challenges ahead of us. I'm here also representing the joint action, Tehdas. We at Sitra, we are the coordinator of this joint action towards European Health Data Space. And European Health Data Space was already mentioned this morning by the Commission representative, so I was very happy to hear that as well. So Tehdas actually is an acronym in Finnish. It means it's a factory and implies, sort of we like to think that it implies that we are manufacturing the future with the help of data. So the Tehdas joint action is supporting the member states and the Commission in developing and promoting concepts and principles and also recommendations that are necessary to support the secondary use of health data for improving public health and for boosting research and innovation, and also enabling data and knowledge-driven policy making and policy steering. So there are, of course, still major challenges, and why this is important. It is estimated that only 3% of healthcare data is used to generate actual insights. So we have a lot of data just lying around, not being used. It's just not being harnessed for better patient outcomes or for improving the quality of care. So definitely, it seems like we also have an obligation for better use of data and for common good. So the European Health Data Space will be a game changer in this regard once it will be adopted and then once it will be implemented. We are definitely positive that it will provide smoother and faster and easier access to this important and life-saving data, whether it's used for research and innovation purposes and also for policy making. But there are, as I said, many important challenges, and many of them have been also brought up. One of the key outcomes of Tehdas' work has been analyzing the barriers for the secondary use of health data. And it's clear that the important barrier in this regard has been legislation, and especially the interpretation of the legislation, because it's really differing from country to country. For example, let's take the GDPR, and it's an important hurdle that needs to be addressed. So there has been proposals on providing guidance and harmonizations, how to deal with that. But I think many researchers are looking for more concrete guidance and solutions to address this big challenge. And it's also contributing to trust, because it's not only trust in science and research and what the sort of outside society has, but it's also the trust of the researchers themselves that they have in the system. So do they have enabling work environment? Is there enabling legislative environment? What kind of tools and support they need? So there will be definitely more support needed for these legislative interpretations and advice so that the data can be used more effectively and in a proper way.
Excellent. Thank you very much. Very good. So you have heard three excellent initiatives. Well, the more general one from Ingrid, but then two very specific access examples really in use. Of course, the health, and but also this multilingualism type of initiative, which is excellent as well, and very much, in my view, closer to citizens. But very much closer to citizen science, I would say, this initiative. So the floor is open for everyone who would like to contribute. So please feel free to raise your hands or questions to the speakers or comments through the Mentimeter. But in the meantime, maybe you warm up your thoughts. Maybe I would like to ask then you, Daria, how to move on? What would be the next step, for example?
Well, what I think a barrier is that there's currently not enough incentives or opportunities for researchers who are developing data within their own context, either national or disciplinary boundary, to transcend those boundaries and collaborate internationally or interdisciplinarily. That's still very hard to do. It's a difficult job. You need to talk, when talking across boundaries, that's a difficult discussion. You need patience, it takes time, but it also takes a lot of resources. And this is something that is still, I think, under-incentivized and underfunded. We do need people to work harder on this, so they need to be better supported to be able to do this job.
So incentives are not enough.
Yeah.
Incentives are good, but not enough. Good. Very good. That's a very good point. Any points from Ingrid?
Well, I was just thinking that relates very much, I recognize that problem very much, and it also relates to the project that you already mentioned that we are coordinating at the moment called Fair Impact, which is funded by the Commission with a sizable amount of 10 million euro. And in that project, we really try to build on the earlier one, Fair's Fair, where we try to foster a fair data culture and uptake of good data practices in Europe. In this project, we have a focus on, let's say, taking all kinds of fair solutions, be it best practices, be it certain tools or techniques, methodologies, policies, etc., identify them, the successful ones in one domain, and trying to adopt them, adapt them, to be used in other domains, and then also support that use in other domains. So that is hopefully also helping this fragmented landscape, that we don't reinvent wheels within the silos of the different domains and subdomains, but that we try to leverage on what we already have and see how we can transport that from one domain to another domain. And we are also looking at solutions that were really much focused on data to see how we can perhaps modify them to make them adoptable for other research outputs, like software, like semantic artifacts, vocabularies, ontologies, etc. So in that sense, in this project, we're also trying to build bridges between domains and hopefully We have a lot of support money in that project, so there will be open calls where potential adopters can get support to really make this work in different domains. So hopefully that helps a little bit as well.
That's a very good point. Oops, sorry. So, from your perspective, you've heard the example of the multilingualism, and I was struck that only 3% of data, health data, is reused or used healthcare data for more research or for more to build better knowledge. So I don't know, just brainstorming here, but what about this linking this approach to multiple languages and representing the data for health care?
Absolutely. I mean, that is definitely the intention, to also bring up the AI and the possibilities that the AI brings, and to harness this data and the big data and use also natural language processing and getting the information in your own mother tongue, own language. But there needs to be also, as I said, enabling legislative environment. The AI Act was just accepted, and there are still many issues that need to be solved in this area, and how also the European Health Data Space proposal aligns with the different legislations, with the Cybersecurity Framework, with the Data Governance Act, Data Act. So it's a very complex sort of picture of the whole legislation, including the specific sector-specific legislation, but then also the horizontal legislations. And this regard, we don't want the scientists to be overburdened by all these different legislations and how they are coming together. So definitely we need also more analysis. What are the implications of all these legislations, and how they can be used in such a way that they are really enabling and not becoming bottlenecks. But I'm not too worried about that, but I just want to highlight this issue because it's very important, as we have identified these legislative aspects as one of the key barriers.
Good, excellent. We will do that, and we will report that. That's very clear. We have a question, another one.
Oh, thank you. Thank you so much for interesting presentations. I'm Katrin Wiklund from Umeå University up north in Sweden. I'm from the medical faculty. And your work in THEDAS is really impressive, and you have presented a lot of different ways to make solutions, but you have also invented the challenges that we have to solve. And you posted a list of number of challenges, of which the major part was legal, and then there were data format and finding data. And I have two questions. First, how should we continue so we can solve all these legal issues? Because the interpretation between different countries when working together in Europe are a great challenge, and it takes months and years to go to the stage that we can retrieve data from the healthcare. A lot of clinical research is creating data that is stored in the hospital systems. Most of the data in the hospital systems are there for primary usage for a diseased patient and so on. And we can only use data that we have ethical allowance legally to use. And then we have the question for the hospital data, so to say. In large infrastructure European projects such as EUCAIM or the other AI for Health Imaging project, we need infrastructures, hardware infrastructures to share data. We don't have a network of national nodes and hospital nodes for data lakes or data sharing of pseudonymized data. There are quite big differences between different countries. Do you have any suggestion how should we solve these two major obstacles? The legal interpretations, I think it's mostly, and then how to build clever hardware solutions for different countries and then for Europe together. Small questions. Thank you.
Thank you very much for bringing up these questions. They are very important. I don't know if I have all the answers, but like I said, in terms of the legal questions, The work is continuing also after Tehdas joint action. So we have definitely identified that there is need for more analyzing the actual implications and what they mean and how we can overcome these barriers. But then who exactly, for example, takes the lead providing this kind of guidance for researchers, for example, or for what are the implications now for the data holders and data users, that will be better addressed, at least for the data holders and data users, than in the follow-up joint action that will be hopefully starting sometimes next year. We don't know yet. But anyway, there are plans, and these gaps have been identified. So we are working together with many other countries at the moment to plan now the work forward and how this could be tackled. In terms of the infrastructure question, I can provide an example from Finland because we already have 9 audited secure processing environments where researchers can access the data, the sensitive data, in a very secure way, and they can process the data, they can use the tools that they need. There are also these different secure processing environments built for different purposes. So you can choose that which one fits for your purpose best, and then you can apply for this. But of course, you also need the study plan, the research plan, the ethical permissions, and so forth. But there are examples that this is happening. And also the European Commission is building the central services at the EU level for cross-border data sharing. So things are happening. It is maybe slow progress in some regards, but definitely things are advancing anyway.
Good, thank you. We have another question for the gentleman here, and then Signe, and then I will give the word to some of the questions through the Mentimeter. Please, go ahead.
Thank you very much for a very interesting session. My name is Jonas Björk, and I'm the Director General for the Swedish Research Council, Forte. I also have some questions related to legislation. We heard from my colleague in Umeå the difference how you, for example, implement GDPR in different countries. However, one must realize that it is a certain flexibility how you implement legislation on national levels, and I think it's fair enough to have that flexibility. So you just have to learn the legislation in your own country. A comment about health data. A lot of interesting and very fast-moving things is happening now in the health data space in the EU, and also new legislation acts is on their way. And as far as I understand, Finland is becoming sort of a role model when you have this FinData and this one-stop shop concept, which looks very nice in theory, at least. So I'd like to hear what kind of practical issues have you seen, because I heard that not everything is sort of blue skies and sun. Can you say something about that?
Of course, thank you. I just want to highlight in terms of the GDPR interpretations that indeed it differs from country to country, but there are sometimes difficult situations when we are dealing with the international collaboration. So that is sort of then creating some extra challenges. But in terms of the experiences from FinData, definitely, I mean, there have been some key learnings. Things are going quite well at the moment. But it's been a learning curve and a journey. So it's been established in 2019. So we've had now more than 3 years of exercise. And in the beginning, I think one of the major learnings was that there wasn't enough resources for that purpose. So it created a bottleneck for the researchers. They had to wait their permit for 1 year. These were the queuing times. So it's impossible in that kind of environment to do your own research if you don't get access to the data. So when implementing the EHDS, definitely we want to highlight the importance of getting the resources, not only in terms of money, but also the human resources, that there are enough capacity then to process all these permits, and also capacity to do the training so that the researchers know what is expected from them at which point, that they know how to fill in the permits and so forth. It can take a lot of time. So, but now I think we are getting there. So the queuing time has reduced remarkably. At some point it was only 1 to 2 months. Now it's 4 to 5 months. It's also because sometimes the holidays and this kind of periods that can cause delay. But it's yes, things have advanced and we have taken the learnings.
Thank you. Thank you. Signe? Thank you.
My name is Signe Ratsa. I'm Deputy Director General of DG Research and Innovation in the European Commission. Many thanks to all the speakers for your presentations and also for giving excellent examples. On the health data, where we've already had some discussion here, I think it's a good example that actually it's an area where both the health ministries and science ministries have been brought together also at the EU level, because actually there are the beneficiaries on both sides. That's clear. Now I have a question also to Ingrid and Daria. You also gave excellent examples from your area of study. And the question is about awareness and actually the role of dissemination of the project results. What kind of role it has and should play. Well, Ingrid, you've been coordinating Horizon 2020, now coordinating Horizon Europe project with very important findings. My question is how much is actually the knowledge, and we've learned that actually it's very low, that the researchers don't know, don't know the FAIR principles, but in order to using them, they should also know what kind of benefits it will give for them. And Daria, you gave already excellent examples on the basis of where the reuse of the data, on the collection of which a lot of resources have been spent, and which could actually benefit other researchers, but also the same researchers if they would have an access to different data in their domain. So really, I think this is really an area where we should make an additional effort in order to increase the awareness and to make sure that actually these things reach also all the researchers who are active on the fields. What you think should be done in order to reach that? Thank you.
Shall I start? Yeah, that is a very challenging question on a challenging subject, I would say. I think starting from the perspective of the European projects, it is a huge challenge how to make sure that what we do in this kind of closed world, I would say, of European projects, how do we bring that message across on a national level and even on an institutional level and a researcher level? Because there is a huge disconnect. I see that in my own country, where I come from, the Netherlands, where we try as an organization to leverage on what we learn in the different projects in which we participate. And we try to organize workshops, seminars to reach out to data stewards in the Dutch institutions and researchers to tell them about what is available on the European level that they could make use of. With respect to benefits and showing the benefits to researchers for themselves and for others of putting more effort into data, I think what we try to do in the projects at least is to work together with researchers through the open calls, but also to ask them to come up, to put a lot of effort in writing adoption stories, taking them out, going to having roadshows, going to the different countries and showing that, and having also researchers talk about the benefits. So we're thinking of all kinds of ways to bring that message across, but it's a difficult message, and I think it also turns down to what you said about it's not only the inspiration and the awareness, but also the possibility of making sure that you that your data set is reusable for others, because that means that you need much more effort to be put in the documentation of your data to make it understandable. So it is a multifaceted, difficult topic. Yeah, and I see European projects especially struggling with that.
Yeah, on a very practical example, if you take a community where scraping data from easily available sources and then doing some quick text mining ends up as an impact factor journal publication, then those authors would be more motivated to jump on the next train, do a little bit of scraping, make an ad hoc data collection, then do something fancy with it, and then come up with another impact factor journal publication. This community, I don't think you should lie or try tricking into selling stories like, you know, make your data fair, it's as easy as 1, 2, 3, because it really isn't. But what we should be doing is coming up with alternative scenarios that instead of 2 impact factor journal publications with useless data for anyone else should be worth less than 1 journal publication plus a data set that then can be reused by the same team and by many others. I think it should be a very clear calculation in terms of input that it's needed and outputs that you get from this community.
Exactly.
Yep. Yeah. And in terms of dissemination or advertising this sort of approach, I think it really would help the most to have access to as many as possible PhD students when they're starting out, and to really show, for example, how I did my PhD, really have a timeline and show them how long it took for me to collect and annotate and clean and prepare my data, and then how much time I had left in the 3-4 years for my PhD to do analysis, and what results I came up with respect to my PhD student that started with an existing data set and what she was able to do. I think that's a very convincing presentation that every PhD student should be exposed to.
Thank you. Great. So we have here 7 questions. I don't know if we will have time to address them all, but some of them we have already addressed. We are addressing through the questions from the floor. But let me select one that is perhaps brings an additional element to this discussion. If a researcher creates a bridge between disciplines, can she, I guess he, publish this effort method findably? Who should curate and store these pathways? Research infrastructures, EOSC, RDA? Kind of provocative question. Any ideas? The person who made the question may want to elaborate on it, please.
Yeah, the idea came from this discussion that you had with that it's so difficult to get the researchers to do the interdisciplinary work, and it's not valued very much. But what I've also seen is sometimes they do this work, and then they see this effort of building the actual process. How do you use the social sciences data together with the atmospheric observations? And then that knowledge stays in their group, or then it completely disappears, and this bridge is destroyed. And the question here is that I do see for FAIR Impact that you try to do something on this, collecting this information together, but whose responsibility should be to store this information if you find it? If somebody uses your language data to do something together with another discipline, is it the responsibility of your RI to keep this information, that this is how you connect this to another discipline? Or is it responsibility of who and where you can publish it? And if you talk about this, you have to get credit out of this work. How do you actually do that? What is the element that, I mean, it's a technical solution per se. How do you connect these things in a workflow or something?
I don't have a solution for you, but this problem is real in interdisciplinary research, and everyone who's collaborating on this is hurt in the process because you're not publishable in that journal from that discipline, but also not in that journal from that discipline. There should be spaces where interdisciplinary work can be showcased and would get academic recognition. I think responsibility should be shared because there is a motivation why the team did this, but also I think that, if the research infrastructure identifies or flags a nice reuse, they should also advertise it as a use case, as a showcase on their end. There should also be, I think, some small projects where people could apply for to really showcase this sort of, because I think interdisciplinary work right now, this is where we will be making the big next step. It's not in silos anymore.
Good. Any other insights?
Well, maybe just shortly commenting that I think it would be good to look into the opportunities in the EOSC and what will be possible there and how also the Commission sees the development. But I think it should be possible. I mean, we also have created this system for the publications. There are these DOIs and you can really identify the publications. So it shouldn't be too difficult if there is political will and also the other actors involved. It should be doable, but I think it's definitely needed if we want to enhance the use of data and reuse of data.
Thank you. Let me choose another of these questions. What are the main challenges in maintaining open and fair research data available over time? That's a very interesting one. So what is the main opportunity in providing open access from your perspectives? Over time.
Over time, yeah. Fair. I think a big misunderstanding is that when you create data and you store them as fair data, that they remain automatically fair over time. That is not true, because data need to be curated over time, and there should be somebody who is monitoring, let's say, the designated community. And their requirements that of course change over time. So if you want to keep data accessible for others, not accessible but also accessible, then you probably need to change things over time with respect to that data set. So that means that the data that are fair also need to live in what we usually nowadays call fair, enabling, trustworthy repositories. And these are repositories that know their designated community, follow the developments, and also perform active curation to the data set. So if metadata schema change, format change, etc., all of that is monitored. So that is really, to my mind, the combination that we need: fair data in trustworthy digital repositories. And that is the best guarantee for making sure that fairness remains over time.
Mm-hmm. Thank you. Any other comments from?
I would just say that this is one of the strongest arguments that I try to use when talking to researchers who do create a lot of data and just drop them on GitHub, forget about them, and then move on. They think that their job is done, but they change jobs, change focus, and nobody will be curating and taking care of the data.
Mm.
Well, I can add that from the point of view of the upcoming EHDS and how we have analyzed the importance of the data quality and the data quality framework and the processes, is that we see a lot of responsibility and the costs are put for the data holder, and it's not really recognized. So it's a key issue that we need to be addressing in the future.
Very good. We are heading towards the last 10 minutes of this discussion. So let me use two questions that I will try and merge, because there is a fair claim here. The theme of this session is trust in science. We are talking more about trust among scientists, but both aspects are, of course, important. So let's dedicate some minutes to that more general aspect, trust in science. So how should how should fair data be communicated to society in order to uphold the trust in universities and research? And linked to that, I will use another one. Do you think that introducing a scale for fairness data is a way forward? So maybe you can reflect upon these questions.
We are actually thinking about introducing a tier system in our repository where top tier would be fully fair. Unrelated to this panel, this is a conversation we're having right now, but yeah, we'll see.
But do you think that how can we better communicate fair data to the public?
Personally, well, I'm thinking back about a situation we had in my own country. It's already a couple of years ago, but we had a big fraud case in the Netherlands. We had several ones in psychology and also in the medical sciences that really showed, and that was big in public debate also internationally. And that showed that there is a lack of trust in science in society. I don't necessarily think that communicating about the FAIR principles would help, you know, the society in creating more trust. What I do think is that, and those fraud cases show that if we really go for fair data, then those cases of fraud would have been much more difficult to make because the researcher wouldn't have gotten away with the kind of research and the data handling that he did. He invented data, etc., etc. So if we would really put a lot of effort in making a certain level of fairness compulsory, then he wouldn't have gotten away with it in a way. So in that sense, I think it's a kind of a safeguard to make sure that we keep scientific integrity. And of course, scientific integrity is needed if you want to create trust in science in society.
Mm-hmm. So some sort of policy to kind of prevent misuses by making data fair. From okay, good. Any other questions from the floor? Last minute comments. There is another question here. Say, do you think that a common EU-wide method of evaluating the levels of fair and open data could encourage data sharing?
Fair data assessment is also a difficult topic. We are starting to do that. There are some tools available. Those tools are also still developing, and there is not one, I think, ideal solution. And what you see happening also is that people are a little bit fearful about these tools because they think, oh dear, now my repository will be assessed, and what if it shows that the data that we hold are not fair, and or a researcher thinks that, and who is going to pay for that or bleed for that? So that is an element we really need those tools, I think, to make assessments, but we also need to see them in the context of further professionalization and further improvement by the researcher, professionalization by the repositories. And we need to be careful that it's not a black and white thing, because up till now we see that the tools also have their flaws, so sometimes scores are not what they should be. So I think tools will play a role in fair data assessment, but we're still on our way to improve that. And we need to be careful not to use them as sticks, but see them really as instruments to give people insight into where and how they can improve.
Yeah, to see as an instrument for improvement, not so much as a judgment instrument. Any other insights from your perspectives about these tools? No. Okay, let me move to the perhaps what it should be the last question. No, if you could give because this is a conference of the Swedish presidency of the EU Council, therefore it is a perfect occasion to pass along messages to our politicians. So if you had in front of you the member states, if you could give them or ask for something to them, one recommendation. Something to have in mind when they define policies, what would you say? For example, Ingrid, what could you say?
I think I would make a plea for further synergy. We heard this morning already about the complexity of the landscape that we have created in Europe, which comes with its own challenges, many challenges. So I think we really need to align within Europe more. But I also missed a little bit the international connection, because the European Open Science Cloud is not an island in an empty sea. It is a big island already, but there are other islands in that global sea emerging as well. And I think that with everything that we do in Europe, we need to look outside of the window to the international world to learn, because everybody around the globe is struggling with exactly the same topics, to make sure that we don't put our investments in things that are already available elsewhere, and that we also try to align. I mean, within the projects that I've coordinated, I've always been very keen on making connections, for example, with the Research Data Alliance, where you have loads of experts who are working in groups on all kinds of data-related topics. And it's good to bring our problems there at that international table, but also to pick out, to choose the elements that have already been discussed and thought about by experts from all over the globe and bring them into our projects and institutions within Europe. So that would be my message, I think.
Well, excellent recommendation. Elina,
Thank
your
you. I want to quote here Javier Barcon's slide and the ESO slogan from yesterday, keeping the feet on the ground and eyes on the sky. I think for the EHDS, it could mean that we have this broader, longer-term vision that we see, and then we are keeping our feet on the ground and we have a concrete roadmap so that we know how we can reach the destination.
Thank you. That's very nice. Very well put.
I have two, please, if I may. One would be that now that open science, EOS are becoming sort of buzzwords with all the ministry people, don't reinvent the wheel on an institutional and national level as well as international level. There's already institutions, repositories, experts that do this well. Don't build new ones just because you are new to the topic or somebody is suddenly interested. This is happening everywhere. Make sure also to introduce the discipline-specific repositories instead of allowing researchers to give their data to private journals. I think that that's important to say out loud as well.
That is an excellent recommendation.
And the second one is when you are raising the bar in terms of fair data for the research community, there are different levels of maturity, not only across disciplines, but also within disciplines. Acknowledge that and support those that need more support. Don't just impose limitations or requirements on everyone as if they come from the same place.
So no one size fits all, but kind of taking into consideration disciplinary conditions, requirements.
And also individual expertise. I think everyone should be able to treat their data as fair, but not necessarily by themselves.
Thank you. Well, ladies and gentlemen, any final comment or question from the floor? Then I think please join me thanking the speakers for their excellent comments and presentations. So, with my wonderful colleagues in the corner, they have been taking notes. I will prepare some messages to deliver to the plenary session, but that will be after lunch. So, please enjoy your lunch. Thank you.